Hello, and today in our medical textbook on page 147 we're doing exercises. I'll read through the text first and then we'll do the new words. Exercises are classified according to whether the movements performed are free, assisted, resisted, or passive movements. A free movement is one performed by the patient himself. The working muscles are subject only to the forces of gravity. An assisted movement is an active movement performed by the patient assisted by the physiotherapist or by some mechanical device, or occasionally by the patient's other limb, auto-assisted movement. A resisted active movement is one performed against resistance, which may be supplied by the physiotherapist or by a mechanical device such as a weight attached to the limb. A passive movement is performed not by the patient himself, but by the physiotherapist. Passive movements are given in cases where it is necessary to retain movements in joints, as in poliomyelitis or some other nerve lesion. In such conditions, the joints are normal but cannot be actively moved because the muscles are paralyzed. Movements must therefore be retained so that when recovery of muscles takes place, their function is not hindered by stiffness of the joints. Moreover, passive movements preserve the length of all soft tissues and circulatory flow and help to retain the patient's memory of movement patterns. In giving these movements, the physiotherapist holds the limb and carries the joint through its full range of movement without overstretching it in any direction. Passive stretching as such to joints which are stiff from disuse, disease, or injury is absolutely forbidden. Passive stretching will produce a reaction in the joint manifested by pain and swelling and formation of further adhesions, so that instead of movement being recovered, stiffness will actually increase and become permanent. And now for some new words. Free movement, slobodan pokret. Assisted movement, potpomognut pokret. A resisted active movement, aktivni pokret sa otporom. A passive movement, pasivni pokret. Attend physiotherapy, biti prisutan na fizioterapiji. Loosen, osloboditi, omogućiti. To be confined in a bed, ostati u krevetu. Retain movements, sačuvati pokretne funkcije. Regain, povratiti. Stretch, istegnuti. Stiff, ukočen. Limb, ekstremitet. Adhesion, trenje. Forbidden, zabranjeno. Circulatory flow, protok cirkulacije. Overstretching, prekomerno istezanje. hinder, spriječiti, ometati. And on page 149, there are 7 questions. So do the 7 questions, and I'll be checking that at the end of these texts. So that's all for now. Bye-bye.